over the last 32 years, I've been doing presentations, giving presentations, and financial planning related or on different topics. But 20 years ago, I invited Dr. Goodman to be a guest presenter on his topic on cardiology and cardiovascular risk reduction. And I remember his presentation very well. I remember he projected a beating heart on the screen and talked about things. And I remember how it made me feel. And I know a lot has changed in the last 20 years. So it's really a great pleasure to have Dr. Goodman give his presentation. So much has changed. Just this very presentation, it wouldn't have been able to be done 20 years ago in this way. So I know that this will be a memorable event for all of us. So I'll just give a little brief introduction of Dr. Goodman. Dr. Goodman is a board-certified integrative cardiologist. He's the director of integrative medicine and clinical professor of medicine at the Department of Cardiology and Preventative Medicine at NYU. And he's also a professor of medicine at the University of Cape Town in South Africa, which is where I know Dr. Goodman from. He's a board-certified cardiologist. And he's also board-certified in internal medicine, in lipidology, critical care, interventional cardiology, cardiac CT imaging, and integrative medicine. I mean, he's obviously very distinguished, so I'm very proud to have him as a guest speaker. And so I'd like just to turn it over to Dr. Goodman.
Thank you, Hillel. Can you hear me? I hope everybody can hear me and see me well. If for some reason you can't, just go into the chat box, and Hillel's monitoring that and make sure that you can hear. Okay, we're all good.
Yes.
So firstly, I want to thank Hillel. I think you can call me Dennis by now. I've known Hillel for maybe 40 years. We go back to South Africa when I was one of his madrihim. And I just want to say, Hillel, that one of the reasons you look so good is because you listened to my lecture 20 years ago, or maybe more, and unlike most people, you actually followed some of that advice. And now you're sitting in your 60s looking great and being healthy. Hillel, I don't have to say because you all know him, is a wonderful human being, and he is a mensch of note and someone that I feel very close to. So when he asked me to speak, I said it would be a pleasure. And I always enjoy talking to people. It doesn't matter if it's 1 or 20 or 100 or 1,000, in the hope that maybe just one person will take on board some of the stuff that I'm saying and literally help to save their own lives, because it really is about you making the changes. Okay, so there's a lot to talk about. I'm going to try to go quickly through some of the stuff, but I am going to touch on many aspects of cardiology, preventative medicine, and hopefully there'll be something that you can take home. So the first thing I want to say is that there are two sort of different groups of people in general when I'm talking about healthcare providers. And you tend to find those that are very Western trained, like myself, with as you saw, a lot of board exams, and you go to medical school, and you learn what we call Western or allopathic or conventional medicine, orthodox medicine, mainstream medicine. And then the other side, where you land up with people that are often naturopaths or sometimes chiropractors, where we talk about complementary, alternative, Eastern, holistic, and integrated medicine. And I put this slide up of the Grand Canyon, this beautiful picture, because for me, there is this gap, this chasm between Eastern and Western medicine. And I am really sad about it, because I believe that patients land up with the best care when both sides are talking to each other. And I made it something that's kind of like one of my life's goals, to try to be a bridge between these two aspects of medicine. And if you look at this, it says integrated medicine might restore the soul to medicine, the soul being that part of us that is most important, but the least easy to delineate. And so for me, integrated medicine, because that's what I am, an integrative cardiologist, is actually bringing together, being a bridge between the Eastern and Western medicine so we can offer the very, very best to patients. And that is one of the reasons it's called integrative. And the other is that when we think about integrative medicine, we're talking about looking at the patient holistically, not just as a limb or as a knee or as a stomach, but looking at the big picture. And I love this poem. I hope you'll go after this and look it up. It's called The Blind Men and the Elephant by John Godfrey Sachs, who was an American poet in the 1900s. And here's the poem. I'm going to read you just the first stanza. And here you see these men, these Indian men from Hindustan in India, and they were all blindfolded. So the first part of the first stanza says, it was 6 men of Hindustan to learning much inclined, who went to see the elephant, though all of them were blind, that each by observation might satisfy his mind. The first approached the elephant, and happening to fall against his broad and sturdy side, at once began to brawl. God bless me, but the elephant is very much like a wall. The second, feeling of the tusk, cried, ho, what have we here? So very round and smooth and sharp. To me, it's mighty clear. This wonder of an elephant is very much like a spear. And here you see all the men of Hindustan feeling different aspects of the elephant and all coming up with something different. Nobody sees the elephant. They all see a piece of the elephant, and of course, they're all getting it wrong. And this is my analogy for what can happen in medicine, because sometimes you go, and it's not sometimes, it's unfortunately very frequent. A lot of people don't have an internist or a primary care physician, and they end up going from one specialist to another. And of course, these specialists are highly trained. But I want you to think about the last time you went to see a specialist. And let me know if you didn't get a test ordered. Because normally, when you see an orthopedic surgeon, I'm not disparaging anybody, but I don't know anybody yet that hasn't been to an orthopedic surgeon that doesn't land up with at least an X-ray. And for most people, it's an MRI. And we've got to a point where some people have to have the MRI before they see the doctor. It's become really sad. I know someone who went to see a cardiologist recently because of some benign skip beats on her EKG. The cardiologist who was trained at Harvard did not put his stethoscope on her chest. He didn't examine her, but he ordered 3 tests. And if you go to a gastroenterologist, you've got a good chance of having an endoscopy and certainly a colonoscopy. And of course, that's indicated if you're above 50 years old. But anyway, you've got my point. You need a captain of the ship. You need someone who's going to look at the big picture. And today it's hard to find that. It's very important that you have someone you trust, someone who can be the captain of your ship. But I'll tell you what's most important. You need to be the co-captain. We're at a time now that you have to take on board that your health is going to depend on the way you look at medical education and how you take on board so that you can be empowered to do the right things. So the impact of cardiovascular disease, I am a cardiologist. I do try to look at the big picture. And we know cardiovascular disease is the #1 killer of men and women in the world and in the United States. And I'm not going to go through all these, but over 2,000 Americans die each day, 1 every 40 seconds. And here are all these really terrible statistics that make you realize we've got a long way to go. And that's why, because of this, we know that, unfortunately, almost half the deaths are due to sudden cardiac arrest are the person's first and last symptom. In other words, most people who have a heart attack and die, they didn't have a symptom before that. It comes as a complete surprise, and they don't realize that they've got underlying heart disease. So what's the good news? 80% of events, heart attacks and strokes, are preventable with lifestyle changes and attention to preventative measures. So what are these preventative measures? I'm going to discuss each one of them. And I want you to know, for me in my practice, every single patient I see, no matter why they see me, I talk about these 4, what I call the pillars, the 4 legs of a stool. I talk about nutrition and supplements where it's appropriate. I talk about exercise and flexibility. I talk about sleeping and good sleep, how important it is. And I talk about stress management. All these things are so important for being healthy. And it's really important to understand that wellness, being well, being healthy, is not the absence of disease. Wellness is the art of finding balance in your life, and wellness is your body and your mind are in sync. You don't have conflict between your thoughts and your actions. So it's really important when we talk about being well and healthy that you pay attention to those 4 things that I spoke about. And when you do, and the earlier you do it, the more chance you are of living a happy, healthy life without cardiovascular events like heart attacks and strokes. So let's start off with what a lot of people believe, that, well, what can I do if I've got bad genes? You know, there's not much I can do about it. And there's a wonderful book that I recommended on one of my lectures that Hillel attended recently. And he went and read this book. And he keeps telling me how wonderful it is. And this is the point. Your genes are not your destiny. You cannot say, well, I got bad genes, there's nothing I can do about it. Or I've got great genes, so I can go ahead and do what I like. It doesn't work like that. Because you've got somebody in your family, if you're lucky enough to be 80 or 90, that smoked their whole lives, or they're eating 4 eggs every morning with bacon or steak or whatever, it doesn't mean that you can do that. It's very unusual to be able to do that and reach your 80s, 90s, and beyond. So it's very important that your genes are considered a risk factor, but they're not your destiny. And I always try to give people the example, you know, if you're sitting with a gun, your genes are what loads the gun, but you're the one who has to pull the trigger. The gun doesn't just go off by itself. And it's that ability to prevent that gun from going off that's preventative medicine. So this is a very important article that came out a few years ago, which proves the point. And this is a study. Just come to look at the left-hand panel over here, where you can see people, and you see here in the red, who had a lot of genetic influence. They had genes that put them at risk for cardiovascular disease. And look what happened when they led a favorable lifestyle, which is the blue bar. They just reduced their cardiovascular event by 50%. So what was a healthy lifestyle? It was exercise, bringing your weight down to a healthy level, no smoking. And those were the major things that contributed to reducing your cardiovascular risk. And there were several other studies that showed the exact same thing. Here's the book. Hillel told me that he's going to recommend or buy this book for you. It's called Change Your Genes, Change Your Life. I'll leave it to Hillel at the end of this to comment on this. But this is a very inspiring book, which makes you realize that if you pay attention to your risk factors, your genes, even if they're not that good, are not going to express themselves. And we now have a whole new science that we didn't know about called epigenetics, which is no matter what your genes do or what genes you're born with, whether they actually exert themselves is basically dependent on your behavior. So we can influence our genes with our behavior. So this is just to talk about diet for a second. I'm not going to get into the details. If you've got questions, what diet should you take? There's so many different diets. People use a lot of fad diets to try to lose weight. Some are successful. The big challenge is, even when you lose the weight, how do you keep the weight off? And this is just to show that basically in cardiology, we really have one diet that sort of stood the test of time called the Mediterranean diet. And here you see what happens. When you eat a Mediterranean type diet, which when you think about a Mediterranean diet, think of what you'd eat if you go to Greece. And it's a lot of olives, nuts, salads, vegetables, and yes, some meat, some fish, but it's not predominant in the diet. So they showed that people who could maintain that kind of diet versus a control diet, which was a lot of fat, which was high fat, the processed food and stuff like that, did much better. And this is EVO, which is olive oil, extra virgin olive oil. Even if you added more of that to the Mediterranean diet, it didn't seem to make a difference. So the Mediterranean diet is the best kind of diet that you can go on to reduce cardiovascular stunts. And it's also something that you can maintain. Plant-based diet is wonderful. For those of you who want to know all about the plant-based diet, there's someone called Dr. Esselstyn, and he's out there, and he is on the far right of what you should be doing. And if you never want to eat meat again, you should watch a movie called Forks Over Knives. And it does keep you awake that night, and it makes you think about whether you want to eat meat again. But I can tell you, I believe meat and fish in moderation is fine if the rest of your diet is a healthy Mediterranean type diet. So that's what you can look like. She's 92 years old, this lady. And that's what can happen if you stretch and you eat healthy. You can see she's not overweight and she's doing her yoga. So I want to just basically explain this concept to all of you, which is why do people develop cardiovascular disease and how does it manifest? And you're born over here with a normal, this is a pipe, which is your arteries that supply blood to the heart and to around your body. They say if you put all your blood vessels together and you put them in a long line, it actually can go around the world. But there are literally hundreds of miles of blood vessels when you put them together. And that is your cardiovascular system. You need these pipes to be open and to be able to provide nutrition and oxygen to your organs and to all your body parts and your muscles. And if there are blockages that develop, you're obviously going to get reduced blood flow. So this is what happens. With time, you slowly develop a fatty streak, which then develops into a lipid core, slowly starts impinging on the artery, and then eventually the artery can block up. So let's look at this last little segment here. This is an artery that's about 80 or 90% blocked. Now, what happened here, where an artery was about 50% blocked, and all of a sudden you get something, and look at this, called plaque rupture. So let me show you what plaque rupture looks like. So this is just to say atherosclerosis is silent until it's not. And what that means is, unfortunately, for most people, it turns out that 2/3 of people who have a heart attack, they have it because of plaque rupture in an artery that's less than 50% blocked. I want to say that again, it's extremely important to understand this concept. When we do stress testing, we are looking for blockages in the artery above 70%. So if you have a stress test and it's, quote, normal, which means that you don't have an abnormal EKG or an abnormal stress echo or an abnormal nuclear perfusion test, it doesn't mean you don't have blockages. It means you don't have a significant blockage of 70% or more. So before I tell you about Tim Russett, who you've all heard of and know, I just want to go and show you something. Let me just find it here. Sorry about this. I don't know. We did practice this, so hold on one second. This is always one of the risks when you do this. Just hold on a second.
Go to the YouTube, Dennis. Just go to YouTube, yeah. And then no, just.
Here we go. Okay, so sorry about that, but let me put the sound down here and do this here for you. So I want to show you what a plaque rupture looks like. So here's a blood vessel. All these little yellow things coming through here are cholesterol, and this is the LDL particles. The cholesterol comes through in the bloodstream, and this is the wall of your artery. You can see it's a pipe, and it looks very clean. So look what happens when you get inflammation, and you start to deposit these cholesterol plaques, which basically when you've got too much cholesterol, and you develop this fatty streak. This is called a lipid core. You see, these are inflammatory cells that start off, and I'll tell you how you get them in a minute. The lipid core develops inside the blood vessel in the wall. And then as time goes along, this is called the fibrous cap. This fibrous cap protects your blood vessel cells, your red blood cells, from this lipid core. This is very thrombogenic, which means that if it's exposed to red blood cells, you get clotting. This fibrous cap, when it's healthy, is nice and thick. But as time goes on, with things like hypertension, diabetes, smoking, stress, inflammation in your body, you weaken this fibrous cap. And eventually, and you'll see in a second, this cap can rupture. As soon as it ruptures, the contents of this lipid core come into get exposed to the blood cells, and they cause a blood clot. You can see this artery here that might have been 30% blocked, suddenly blocks completely. And here's what happens. If the blockage occurs right here, this is called the left anterior descending. These are the blood vessels that supply blood to the heart. And this here is a heart attack. All this part of the heart, as you saw over there, is then exposed to the blood vessels. So let's just go back here. Sorry about that. Hillel, so much for our...
Let's go to the presentation.
Where is it now? Sorry about this.
Yeah, there you go.
You're back. Thank you. I was trying to embed it in the presentation, but it didn't want to work, so I had to do that, but I'm glad you got to see it. So here you see Tim Russert, who unfortunately passed away. He was age 58 many years ago. And he was, as you know, an amazing man who worked for NBC, and he did a program called Face the Nation. And at age 58, he was sitting in his office and he developed that plaque rupture that I just showed you. And here you see the exact same mechanism. The plaque ruptures, you see a blood clot. And when that happens, the heart suddenly gets a lack of oxygen and you're at risk from having something called ventricular fibrillation. And you can see here down here, the EKG with ventricular fibrillation, and that caused a cardiac arrest. And in his case, he didn't make it. And everybody went and said, well, what happened? He didn't have symptoms before. And in fact, 2 months before, he had a stress test that was apparently, quote, normal. And his lipids were good. His LDL was below 70 because he was on a statin. And so what actually happened to poor Tim, that's the way I think about it, is that he was one of the unfortunate people that had plaque rupture because he had risk factors and he didn't know that he was sitting on a time bomb. And you must be all sitting there and go, well, how do you know? And I am going to show you how we know. So let's contrast plaque rupture with what a lot of people present with, which is a blockage developing in an artery, and you see it here, where if it gets to above 70%, you can see that people will often present with chest pain, and this is called angina. And so when someone presents to the doctor with exertional chest pain, we think, could this be the blocked artery? And the way to prove it or not prove it is to rule it out is to have a stress test. And you can see here that these people, this man's having a stress test, and we can detect on the stress test whether someone's like to have a blockage. If you have a blockage, you can see here that one of the things we can do is put stents in, and you see this balloon and the stent being pushed across the artery. And here we put a stent in and we open up the artery. So that's one of the ways that we can treat a blocked artery. And I want to show you these angiograms. Here you see someone who comes to us on the top over here with basically having chest pain, exertional chest pain. And you can see the blockage here, right here of 70% or more compared to this. And we put stents in, and this is what it looks like. Here's somebody down at the bottom, this left panel here, who has a completely blocked artery because of plaque rupture. And then we go in and we put the wire down in the stent and we open up the artery. So you can see the two different presentations of coronary artery disease, one with exertional chest pain and a blockage above 70%, and the other with plaque rupture. So carotid stenting, this is what happens in the carotid, which is the arteries that supply blood to your neck. And you can see here a 95% blockage in a carotid. Obviously, if this blocks off, there's a huge risk of a stroke. And here's a stent that's been placed. Here you see the artery, and here you see the wire in the stent. We're at a time now in medicine, and Hilaire alluded to this, things have changed so much. In the old days, you would have had to have something called a carotid endarterectomy. And today, you can have a stent put into the carotid if it's appropriate. So here is one of the tests that can be really helpful to know if you've got underlying coronary artery disease. Because this test is independent of other risk factors. So that means high blood pressure, smoking, diabetes, family history, low HDL, high LDL cholesterol. This is called a calcium scan. I'm sure some of you listening today have had this scan. It's like all you do is you go into the CT scanner. It takes 2 minutes, and when you come out shortly afterwards, you'll be given a result with a score. And it all depends on whether you've got calcification in your coronary arteries. So atherosclerosis starts, like I showed you, with a fatty deposit, and eventually that atherosclerotic fatty deposit becomes calcified. And you could ask, well, why did it become calcified? And it's really the body's protective response. Because if you've got a calcified lesion, it doesn't have plaque rupture. It's like cement. You can't break through a cement wall. So it's the body's protective mechanism. But as you develop more calcium inside an artery, So there are many other areas that are developing what we call soft plaque, which make you vulnerable to plaque rupture. So this is what it looks at here when there's calcification, and you land up getting a score. And these are the scores that we report. You'll get an exact number. And if the score is 0, that's what you want. No evidence of coronary artery disease. Certainly, there's no evidence of calcification. And as you develop a higher score, you have more extensive coronary artery disease. And there have been many people who go in and have a calcium scan because their wife gave it to them for a birthday present, or somebody pulled them in there, or somebody suggested it. They land up having a score that's high, and they land up having a stress test. They find out about coronary disease that they didn't know about, and they often land up having a stent or bypass surgery. So it's one of the most important tests that you can have if you've got risk factors for coronary artery disease, because it tells you whether or not you've actually got plaque at this moment in time. And clearly, if there's underlying plaque, you want to be very aggressive about preventing its progression. So here's what this plaque looks like. This is a scan of the carotid artery, where we can actually see if there's plaque with an ultrasound. You don't need the CT scan, but we can see the same thing with an ultrasound. Now, the question is, should I take statins? This is a question I get asked all the time. Do I need one? What if I can't take it? What if I don't want to? And the other question I get is, should I take supplements? So how do we answer this question? Well, it depends on who you ask. And obviously that depends on who you see and who you ask. And one of the things that I'm going to show you today is that the indications for statins based on the ACC and AHA guidelines are very clear. And I'm not going to get into the details of this, which is basically the guidelines for every healthcare provider of whether or not you should take a statin. And it depends on your risk factors, and it depends on what we call your risk over the next 10 years. We can actually put all your risk factors into a calculator, which you can do yourself. There's something called the ASCVD calculator. It's an app. You can put in your age and your blood pressure and your cholesterol, and it'll tell you what your risk is over the next 10 years. And we believe that even if you're asymptomatic and your risk is above 7.5%, that you should be treated at least with a significant reduction of risk factors and maybe even a statin. So there are two groups of people when it comes to talking about statins. One is people who've already had a heart attack and an event, and they are people who've had a heart attack, a stroke, a TIA. They've had a previous angioplasty or stent. They got peripheral vascular disease. They may have an abdominal aortic aneurysm. And those people need a statin. There is no controversy, because we believe they've landed up with an event because their cholesterol was too high. Even if it doesn't look like it's too high, it was too high for that person. And the studies in the literature, and clearly this is in the Western literature, with hundreds of thousands of patients, to show that you can reduce cardiovascular risk by 35%. So 1 in 3 people will prevent having another heart attack or stroke if they're on a statin and lower their LDL. And how low should you make it? Well, we think today you should get it as low as possible, even to 50 or below, and you should take a statin. The group that's much more difficult is people that are asymptomatic. We call this primary prevention, and we don't know whether to put them on statin or not. I told you secondary prevention is easy because you've had an event. These are people that we call high-risk individuals. Smokers, diabetes, high blood pressure, family history, a very high LDL cholesterol, above 190 in general, obesity, stress, and a 10-year risk score above 7.5%. And I have seen hundreds, if not thousands of people who come and see me with a high cholesterol and one of these or two of these risk factors, and they want to know if they should be on a statin. And one of the ways that I evaluate them is to look for, do you have underlying plaque on a calcium scan? And do you have other markers that I consider high risk for atherothrombosis, which means a high risk for a heart attack? And one is an LPA. So if you haven't had an LPA and you've got a high cholesterol, it's something that you should ask your doctor. Check your LPA levels. It's part of the LDL particle. It's a blood test. It's very easy to measure. The LDL particle in size is not as important. It clearly was one of the things I looked at for a long time. I'm now focused much more on LPA and calcium scan. So if your LPA is high or your calcium scan is abnormal, that means anything above 0, I am on the side of being aggressive. Aggressive means I'll try to get your cholesterol down with some natural ways first, but if that doesn't work, I would reach for a statin very quickly. So these are a blood test called advanced lipid tests. One of them is called Boston Heart. Some of you may have heard of these tests. There's one from Quest. There's Cleveland Clinic has a test called Cardio IQ, and they tell you here what's your LPA. This in red here is showing that this LPA is very high. The LDL cholesterol is 149, but the fact that the LPA is so high means that this 149 is much more significant. So for some people, they don't want statins, and they'll do anything but take a statin. And I think it's important for people to understand, yes, there are times when you don't need one. I just told you when I lean towards not giving people a statin. But if you do need it and you decide not to take it, because a lot of people think it's going to mess with my liver, it's going to give me muscle aches, I always say to them, you've got to weigh that risk against the risk of a heart attack and stroke. It doesn't make sense to worry about muscle aches if you're at major risk from a heart attack and stroke. The muscle aches do occur, but we can always make changes. You can take CoQ10, we can lower the dose. Liver problems from a statin are not an issue. I've never seen a case ever in my practice where someone had liver failure or we couldn't get the liver enzymes back to normal when we stopped the statin. So please, for those of you that are thinking about your liver when you take a statin, you can take that off the table. So here are two things that I wanted to be aware of. This is something called bergamot. It's found in Italy. It comes from the skin of this fruit that's like a lemon called bergamot. This is red yeast rice. These are natural substances that lower LDL cholesterol. Bergamot, I took bergamot, my LDL came down by 60 points, and so did my cholesterol. Red yeast rice is the same as lovastatin. It actually is a statin, but it comes from a rice, a red yeast rice, and you can take that instead of a pharmaceutical statin. A lot of people like to take it because they think it's natural, but in fact, the problem is it still acts like a statin, and you can have the same side effects that statins have if you take a high enough dose. So here's a little study with bergamot showing how you can lower cholesterol. Here's the LDL cholesterol here from 160 to 100 after only 120 days, 3 months. So here's a case study to show you an example of a real life patient, 63-year-old female. Her father died of a heart attack at age 47. That's a very significant risk factor. He has her cholesterol 303, the LDL 189. The HDL is high. HDL is the good cholesterol. So we go, well, that's good. And the triglycerides are normal and a great number of 54. Should this person who asked me, should I take a statin? She's got a family history. She's got a high cholesterol. She's also got a good HDL cholesterol. And I said, get a calcium scan and let's get your LPA level. And she had a calcium scan of 0. Her LPA level was not elevated. This is what a calcium scan would look like if it's abnormal. Here you've got calcification. This is not a 0 test. So she's somebody that I would say, listen, I'm not going to reach for a statin, but let's try bergamot and modification of risk factors and see if we can get your numbers down with just lifestyle changes. You could say to me, well, why wouldn't you put her on a statin? At this moment in time, she's not demonstrating underlying atherosclerosis. And if someone has a calcium score of 0, their prognosis is excellent. There's a 0.5%, less than 1% chance of an event in the next 10 years if you have a calcium score of 0. Of course, it should be rechecked after I check it again at 5 years. And if someone has symptoms, you cannot rely on a calcium score of 0 because you can get soft plaque. You can get plaque that's not calcified and still have a score of 0. So it's very important to understand that you can have a plaque or you can have a lesion that is not going to be picked up on a calcium scan, and you have to attend to that. It's unusual, but it does occur. And how would we know? Anybody who comes with chest pain, I'm always going to be aggressive about making sure they don't have soft plaque. Let's talk about supplements for a second. This is a fellow that I went many years ago when I was at Scripps, and I was very interested in supplements because people were coming and asking me all about supplements. And I went to see this guy at one of those supplement stores, and I asked him, what would you like? What would you give somebody who's trying to prevent a heart attack and stroke? You know what? He took off the shelf about 6 things. And while I was there, a whole lot of people walked in and they were buying stuff for arthritis and headache and this, that, and this. And I said, wow, all these people don't ask about side effects. They just take the stuff. They pay you no problem. I said, how much education did you get to know all this stuff? He said, well, he went to a 6-week course. And I said, it's funny, I studied for 13 years. I can't get people to take stuff. And when I do, they want to know what are the side effects and should I take it? And a lot of time it's too expensive. So it is always amazed me that people somehow have a real trust for someone in the vitamin store and not so much for the doctor. And it's because people in general like to think that these supplements are safe and they can't hurt you. And therefore, why shouldn't I take it? But what I'm saying to you, which is so important, you want to have evidence that that supplement may help you and that it's coming from a very reputable nutraceutical company. Because as you've seen many times, and this was in the newspaper a couple of years ago, a lot of the supplements have fillers and they have nothing close to what they actually say they have in them. And sometimes you're taking a product without any active ingredient. So what is my take on supplements? I think that we can get all our nutrients in general from food. That means healthy food, fruits and vegetables like this. But unfortunately, people don't eat like this. And a lot of times people are nutrient deficient. A lot of times it's from their diet. And sometimes even if they are eating green vegetables, they may be buying it and it's not coming from a place where there's got healthy soil. So a perfect example of that is magnesium, which if you may be eating a lot of green vegetables, which contains magnesium, but if they're not grown in healthy soil, you're not getting magnesium in your vegetables. How can you be sure that you're more likely to have healthy vegetables? You get your vegetables from a farmer's market, or hopefully better and not quite as good is organic foods. What are my list of supplements to consider? I can't go into the details here, but when anybody says, what supplements should I think about? These are they: a multivitamin, vitamin D, vitamin K2, magnesium. Here are the dosages. I'm sure Hila will provide you with the slide and you can see exactly what this is, or you can email me. CoQ10, fish or krill oil, vitamin E, and berberine. These are the supplements that I talk to every patient about, particularly these top 5, which I call the big 5. So here are supplements that help to lower cholesterol. I told you about 2 of them, but there's a whole group of them. I told you about bergamot and red yeast rice. This is a great article which you can find that actually delves into the details, very readable, and it talks about fact or fiction. What is the impact of supplements on lipid levels, which means your cholesterol, your triglycerides, goes through each one of these. I know some of you have heard, well, garlic lowers my cholesterol. Well, when you read this article, you'll know that garlic can lower cholesterol, but it's never been shown in a big study and proved to actually save anybody's life. And so it's even hard to show that it lowers the amount of plaque progression. So all these things that you hear about, there's brilliant marketing, but we don't have good data for it. And that's why it's important, if you're going to take things that are quite natural, that you've got real science and good studies behind it. Here are green leafy vegetables. I happen to be a big fan of magnesium. It's very important. I wrote a book called Magnificent Magnesium. And you should know that magnesium can really help you in many ways. It helps to avoid heart attacks. It lowers blood pressure, helps with cramping. It helps with sleep. It helps to increase calcium absorption. And this is one of the, unfortunately, body does not make magnesium. So it is something that you should supplement, especially if you're not eating a lot of green leafy vegetables. You can even check a magnesium level. It's important to get an RBC magnesium level, not a serum level. That's not good enough. But this is a very important supplement. Magnesium is involved in over 350 enzyme systems in the body. And what's most important to know is it helps to convert ADP to ATP, which is really your energy source in the body. It's like your car. If you don't put the right gas in, it can't function optimally. And that's why ATP, which is so important, is needed in the body, and magnesium is major cofactor for getting ADP to ATP. Vitamin K2, I'm just going to, in a nutshell, tell you, I'd say most Western trained physicians don't know about this. Vitamin K2 is something that helps to take calcium and move it into the bones. Wow. So it helps to remove calcium from arteries and puts them into the bones. There are many studies. Most of the studies are epidemiological studies and show that people who eat a large amount of natto, so this is what natto looks like, where there's a high content of vitamin K2. They've shown that in places like Eastern Japan, where people eat more natto, they have less fractures. And this started a whole series of research into, well, what's going on? And what they found is that people who eat a lot of natto, which is high in vitamin K2, have less chance of osteoporosis and fractures. So this is a study, I'm not going into it, but it basically showed that people who were eating more than 4 servings a week of natto could reduce their bone marrow density, their bone density to levels that were premenopausal, the rate of change. And that's very, very helpful. The problem is, should you take vitamin K2? It's a tough one because we don't have a lot of studies to prove that if you take it as a supplement, it can help you. There are several studies that help for osteoporosis. In the cardiovascular health world, what we do know is this is a Dutch study from 2004. People who ate a lot of K2 in their diet had a 50% reduction in heart attacks and aortic calcification, and a 25% reduction in mortality. Large number of patients, again, suggesting that vitamin K2 is very helpful. We're still awaiting studies in the cardiovascular space where if you take vitamin K2 as a supplement that you're going to reduce calcification. There are ongoing studies right now. So if you ask me, well, how do I get vitamin K2? I would say to you right now, the best way to get it is to get some natto, and you can email me and I'll tell you where you can get it from. I know someone who makes it and they'll ship it to you, or you can get it in any one of the Asian stores because Japanese people love natto and they clearly can eat it. It's not that easy it's not got a great taste. It's a bit like seaweed. But I can tell you, if you can eat natto, a teaspoonful every day, I have no doubt in my mind that you will have much higher vitamin K2 levels. And I did write this book called Vitamin K2, The Missing Nutrient for Heart and Bone Health, which talks all about why it's important and how you can supplement. Now, when I say supplement, I mean, as I just told you, predominantly with diet. But I do believe that if you're on a statin, I think that statins deplete CoQ10 and vitamin K2. And as I said, that can increase calcification. So I put people that are on a statin on CoQ10 and vitamin K2. It's controversial. It's debatable. There are people certainly in Western medicine say we don't have the data for it. And I say that I've had many patients where I do use it, and I've certainly seen benefit with CoQ10. So here is someone I know. There's an article from the New York Times. Are you ready to eat your natto? She makes natto, and she will ship it to you. And here it is. And you can get 180 micrograms easily per day, which is the dose that's recommended if you have a teaspoon of this every day. And what it is actually soy that you mix with bacteria. Vitamin D.
Dennis, just giving you a 15-minute warning.
Perfect.
Keep going.
Vitamin D promotes the body's absorption of calcium, and it's essential to develop of healthy bones. This is a very important nutritional supplement. You should have your vitamin D level checked. And if it's below 30, I would suggest that you supplement. Certainly you want to increase your sun intake if you can. And this is a whole story about what you need to know about vitamin D. I'm not going through this. If you've got a question, you can ask me. Here are the optimal levels. This is an easy one because you can check your level. And the best test is a serum 25 hydroxy vitamin D level. You should know what it is. And if it's deficient, you are at higher risk from hypertension, diabetes, hyperlipidemia, inflammation. So important to know what your vitamin D level is. Let's talk about sleep. I mentioned it. People that are not sleeping well have a higher risk of many problems. So if you're snoring, or if you have fatigue during the day or in the morning, or you've got morning headaches, or someone says who sleeps next to you says your breathing's irregular, it looks like you stopped sneezing, it looks like you're snorting at night, it looks like you're holding your breath, or you have insomnia or daytime sleeping, you may have sleep apnea. And these are the medical conditions associated with sleep apnea. What sleep apnea means is that you're obstructing your airway at night and you're not getting enough oxygen to your brain and to the rest of your body. It's linked to high blood pressure, cardiac arrhythmias, heart attack, stroke, depression, diabetes, obesity. And it's really important that you check for sleep apnea if you have one of these symptoms. It's very easy today. There's things called oximeters. Here it is on this man's finger. You can take this, we can send people home with an oximeter, and it measures your oxygen level throughout the night. One of them is called a watch pad. but you can just send someone home. Doctors' offices have them, and you should know what your oxygen levels are throughout the night. If your oxygen levels are dropping, then you need to be screened properly for sleep apnea, and there are treatments for it, including dental devices, and sometimes you need a CPAP machine. So let's talk about stress in the last 10 minutes. This is another major risk factor for heart disease. I'm a little stressed right now. Turn around and leave quietly. What we now know is that stress is a significant risk factor for heart disease. 75 to 90% of all visits to healthcare providers result from stress-related disorders. What they've shown is people who have heart attacks, there were 1,600 heart attacks tracked. What happened 2 hours before your MI? Anger increased your risk of heart attack by 2.5 times. So unfortunately, when you're raging or you're angry, even if you're holding it in, your blood pressure is going up, your adrenaline levels going crazy, and that puts you at risk from a heart attack. So what is the story? The story is when your sympathetic nervous system's in overdrive, you're likely to have an increased heart rate, your blood pressure goes up, you start sweating, and that puts you at risk. We want to increase the parasympathetic nervous system. These two things work in tandem. You want to reduce your sympathetic tone, increase your parasympathetic tone. This is what makes people feel relaxed. It brings down the heart rate, reduces blood pressure, promotes relaxation. How do you do that? Well, the best ways to stimulate your parasympathetic nervous system is exercise, yoga, meditation, biofeedback, simply sitting and listening to music, a lot of things that most people don't do. This is something I thought is just funny and interesting, looking at stress and pets versus children. If you look on the left-hand side here, and these are cardiovascular risk, your cardiovascular risk. As you have more children, you see the cardiovascular risk going up. I mean, that's not surprising. We all know that, although we love them to bits and they bring us so much pleasure, there's an increase in stress. What about pets? People who have pets have a lower stress level. We know that. It's true. One of the reasons is that you walk with them and you get out and have exercise. Another reason is that it's just one way to have brilliant socialization. I have been amazed that if you've got a dog or a cat, but mainly a dog, you can stop and speak to anybody you like, and nobody will tell you that you're a predator. You can stop and everybody will talk to you if you've got a pet. So this is one of the reasons that it lowers stress. But look what's funny. If you look at dogs, it turns out if you've got 1 or 2 dogs, you've got less stress.
Oh.
If you've got more than 1 cat, you've got more stress. So what is clear is dogs lower your stress. The more cats you've got, the more likely you are to be stressed. Of course, it's much better than having no pets, but if you want to compare dogs to cats, maybe someone will argue with me, but here's a definite study showing you're better off with dogs. So this is a young lady. I'm not going to get into this, but she came to see me and she was very stressed, was having a lot of panic attacks, and her adrenaline was really high. She always had a higher heart rate. She was wanting to fall pregnant. She didn't want to be on medication, and I sent her for biofeedback, which has all these benefits, and it was unbelievable. She was able to calm down. She became pregnant without medication, and she is now a big believer, and biofeedback is just a way that you can be in touch with how your heart rate and your blood pressure are lowering, and it really is just breathing techniques. So what about the last few minutes? Caring for strangers is one of the most important things that you can do to lower stress. Caring about other people. And if you haven't watched this YouTube, it's really worth it. And this is Robert Waldinger. I think there are millions of people, 21 million people have downloaded this YouTube. And it refers to something called the Harvard Longevity Study. In 1938, they started a study at Harvard looking at sophomores. There were 248 sophomores, and they followed them for 80 years. So there are about 15 of them, between 15 and 20, that are still alive in their 90s. And they looked at what are the things that contribute to having a healthy, happy life, a long life. And what they found out is that the people that have socialization, someone in their life that they care for and they care about, are much more likely to live longer and happier lives than people who have more money and more possessions. It's not something we don't know, but this is the evidence for it. And it was clear that people who have who are still married, or they have a companion, or they've got children that they're connected to and grandchildren, or they're helping strangers by going out and volunteering and doing community work, do much better. I'm not going to go into this now because we just don't have time, but this was a wonderful patient of mine who ended up having surgery. And the night before surgery, they called me to say he doesn't want to have surgery. He's very scared and he doesn't want to do it. He thinks he's going to die. And I went over to his place and I managed to talk him into doing it because otherwise he wasn't going to make it. And he said, would I be in the operating room? And of course I agreed, even though I wasn't able to spend 5 hours there. It turned out in the preoperative area, his son is a singer, is a professional singer. And we sat in the preoperative area and we sang songs. His favorite song was it's just missed my mind. Yeah, I'll tell you in a minute. But we sang songs to him, and he turned out to go through surgery beautifully. And a week later, he said to me, "You know what? When I went into surgery, it's the song's called King of the Road, by the way. When he went into surgery, he came out and he said, I felt like I was going in on the hands of angels." And so wouldn't it be nice if instead of people going to surgery who are anxious and stressed with a high heart rate and a high blood pressure, if we could calm them down before surgery, they will do so much better. And here he is getting an award because he's a toy maker. He invented the game of life. Here we are in New York. He's getting an award at the toy maker convention. And here he is 12 years later. He was 82 when he had the surgery in New York. I went to visit him at the Waldorf Astoria and we sang King of the Road. And here he is very recently. He's 99 a few weeks ago. And please God, we're going to celebrate his 100th birthday. This is a study showing that actually when you do guided imagery before cardiac surgery, people do much better. So I'm going to end off by saying, always think about how you can reduce stress levels. I love this little cartoon. What day is it? Asked Pooh. It's today, Squeak Piglet, my favorite day. So I'm all about attitude and gratitude. And I think if you can think like this, I'm at peace with my past, I'm in love with my present, I'm excited for the future, you're much likely to be happy and healthier. I hope that I've given you some information that can be helpful. I'm at NYU. I have a heart health lecture series every month. Here's a website, here's an email. We do a different topic every month where I have an expert speaker and sometimes I speak and I always moderate it and we pick a different topic in cardiology, high blood pressure, diabetes, stress management, whatever it is, and we get into the weeds on that particular topic. So thank you very much, Hillel. Thank you for inviting me. I try to race through that and give you a lot of information.
Well, thanks so much, Dennis. There were just a few questions in the chat box. If people would like to stick around for just a couple of minutes, you can maybe talk to those. But I just want to thank everyone for taking the time to join us and to hear Dennis's presentation, which I thought is amazing, outstanding, and excellent. I recommend that you buy his books, which are available on Amazon. And Dennis was alluding to the fact that during the presentation, he talked about this book. And I watched his presentation a few months ago and I read the book and it's amazing how much I've learned. So for the fact that you have taken this time to join us for this special event, which is a hybrid event, which I'll explain in a minute, I would like to make this book available to you. All you need to do is in the chat session, in the chat box, let me know if you'd like a paperback one or a Kindle version and put your name and address in the chat box and I'll send it to you.
Hillel, just mention the book. It's called Your Genes Are Not Your Destiny, just so people know which book you're
reading. Sorry, Your Genes Is Not Your Destiny. It's amazing. It really, what Dennis was saying is it's the bigger picture. It's the things that really we can control. It's like, as Dennis said, it's really, we have the finger on the trigger. Our genes are not our destiny. We can actually, through stress reduction, through eating well, through resting, through yoga, and I'd like to invite everyone to come and join me for a swim in the ocean tomorrow at 7 o'clock. If you're in San Diego at Fletcher Cove, please join us. That's one way. And another thing is this is a hybrid event and this is the virtual portion. So the live portion is up to you. I see the sun coming down in San Diego. I know there's some people from other parts of the country, but if you take a few minutes just to go
You know what? I will answer these. I'll take these questions. I'll answer them very quickly. So we try to get through all of them. And I think that if people, want to leave, it's okay. And if you, would you like me to go for 5 minutes? Because I know you want to talk about the hybrid. So how much time do you want me?
This is very important. Please go ahead, and for those that can stay to get their questions asked, that's great, and answered.
So I'm going to try to do this quickly so that we can just get to answer everybody's questions. I'm curious about reversing a higher than normal calcium score. This is from Kathleen. Great question. Should I take something? We can't reverse a calcium score. Think about it, it's like cement. It's very, very difficult. I mean, I've heard of it, but I have never seen myself a calcium score going down. But here's what you can reverse. When you have a high calcium score, you're also more likely to have soft plaque. And it's the soft plaque that's dangerous. You can definitely inhibit soft plaque formation, reduce the amount of lipid core with risk factors. We haven't proven that you can do it yet with K2, MK7, beta-cyclodipeptide. It's not proven. We like to think that vitamin K2 would do it. There's a study right now coming from the Netherlands that's looking at calcium scores with vitamin K2. Let's wait for that. Be in touch with me. I'll give you the results. So you can reduce soft plaque when you have a high calcium score, but not the actual calcified part. And as I said to you, which is really important, it's the soft part that's dangerous, not the calcified part, because the calcified part will contribute to a blockage above 70%, and that you'll know about because you have symptoms and you have an abnormal stress test. How often do you suggest having a stress test to avoid sudden heart failure produced from an angiogram? It's a very good question. Is this Joe's Al or Joe's? I'm not Jossel. The question is, should you do a stress test? The stress test, as I pointed out, is not going to screen you for blockages above 70%, below 70%. You will only pick up an abnormal stress test when you have a blocked artery above 70%. So what I told you is that 2/3 of heart attacks occur in arteries of blockage less than 50%. You need to have, if you're going to have a test to screen, it's a calcium score. If you don't have chest pain or shortness of breath or a cardiac symptom, we don't do stress testing. So some doctors like to put you on a stress test for other reasons. They want to see if you're fit enough, or what happens to your blood pressure, or do you have an arrhythmia. But in general, stress testing is not screening for coronary artery disease. It is a screen for coronary artery disease with a blockage of about 70%. So I hope I've answered that. I've got no problem if your doctor wants to do a stress test. You should know that it doesn't rule out blockages below 70%. My doctor prescribed, this is Hillel, a lipid for me.
I meant a statin. A statin.
I figured my health is good and my blood labs are good. Does it make sense for me to continue taking the statin for the rest of my life? Hillel, I hope you got some of the answer from my talk today. Let's find out if you really need that statin. I don't know if you've had one, but you should have a calcium scan. You should have an LP(a) and maybe a carotid scan. Let's see if you've got plaque. If you've got underlying plaque, you should certainly take it. If you've got multiple risk factors, it means more likely. Somebody could make the case, well, if you don't have a lot of plaque, it's because you took a statin. I can't argue with that, but I don't prescribe statins in general unless I feel that someone's got multiple risk factors, they're high risk, and they've got already atherosclerosis. So you're in the primary prevention group, Hillel, where it's important to look and see whether you really need it. You're not in the secondary prevention where it's absolutely indicated. So we can talk about that offline.
Thank you.
Kathleen, I've never had high LDL or elevated HDL or total cholesterol, but I have a high pulse score and a high calcium score. I've been able to reduce pulse score with 5 milligrams of rosuvastatin. Nuclear cardiac imaging was normal, no angio stress test. So I think what you're saying is that you don't have high LDL or elevated HDL, which would be a good thing, by the way. But I have this score which basically says that you've got underlying atherosclerosis. So you do have atherosclerosis, and it is important in your case to take a statin. And I would 100% agree with 5 milligrams of rosuvastatin, which is Crestor. How do we influence the MDs to write a prescription for a stress test? Okay, so we go back to what I said before. Why do you want the stress test? If the stress test is going to tell you whether you have a blockage above 70%, you would have a symptom. So doctors tend not to want to do a stress test for the reason I told you, because it's likely to be quote negative if you don't have a blockage above 70%. If you ask your doctor for a stress test, he will say, why do you want to have it? And if you say, I want to rule out coronary disease, he's going to say, you can't do that. I can rule out you don't have obstructive coronary disease, but I can't rule out any coronary disease. And I would suggest, Jocelyn, that you ask for a calcium scan and only think about a stress test if you've got symptoms. What is the long-term side effects of a statin? Hillel, we can talk about that offline. We don't have any real long-term adverse side effects. The biggest side effect is muscle aches. There are some people very rarely that can get a condition called rhabdomyolysis, where you really have a problem with muscle breakdown and kidney failure. It's extremely rare. Long-term statin side effects in general are not something that we concern ourselves at. We've never proven that it has cognitive side effects. You should stay on your statin if you need it, because what is clear is that the reduction in cardiovascular events is much more important than worrying about a long-term side effect. It's a little buck. I hate to give you this analogy, the vaccine story right now. There are many people that are anti-vaxxers because they're worried about what's going to happen in the long term with the vaccine. We don't know what's going to happen with an mRNA vaccine. And I say to them, you're right, we don't know. But we do know that if you get COVID and you're unlucky, you could die. So I tell people, take the vaccine. Obviously, that's for another talk, but that's how I feel. What nutraceutical companies deliver high standards of products? John, I'm very happy to tell you what they are offline. And that's a very important question. Designs for Health, Metagenics, Thorne, there are several, but I'll give you their names. Glenda Sachs. Hi, Glenda. Supplements. Calcium. Firstly, John, thanks for joining. I'm really happy to see you there. Calcium, yes or no? Glenda, I'm trying to remember how old you are. Women should take a calcium supplement because it helps to prevent osteoporosis. And the way it does is you need calcium for your bones. You also need vitamin D to absorb the calcium. I do believe that women should supplement with calcium. And how much? Probably a gram a day, 1,000 milligrams, and you should take at least half that dose in magnesium as well. Oh my goodness, that's wonderful, but natto is tough to eat. But you know what? If you put it and you add it with certain things, like your cereal, you will get used to it, or with some crackers. I have tasted it and I didn't like it at first, but I can tell you, if you take a teaspoon and you get used to it, you are doing yourself a favor, because I believe vitamin K and K2 in that form is the best way to take it. Thanks, John, for that nice comment. Is there a PDF version? Well, we can definitely send you the slides, but this is not and I think Hilal's recording this.
Yeah, so I'm recording this.
You can watch
it. This will be available. Yes. Okay,
paperback. Thanks, appreciate it. Okay, thank you. Wonderful. Thank you for all the good questions. Last question. Glenda, you're 62. I think you should take calcium. So my stress test with the dye was useless. If I didn't have a cent, you are quite right, Zoe. You've got the message. I don't want to use the word useless. It's not the right thing to say, because it might have given you information. Your doctor will find out how fit you are, what happens to your blood pressure, is your rhythm good, but it doesn't diagnose whether you have blockages of less than 70%. And I've made that point again and again. Those are the ones we worry about, because 2/3 of heart attack occur in blockages less than 70%, where you have soft plaque. And the plaque rupture is what's dangerous, and I showed you a picture of that. So we'll end it there. Hillel, thank you.
Dennis, I just want to thank you very much. This is such an amazing presentation. I'm just blown away at how you put this all together and explain it. And it's so, we can change our lives. We're responsible. We put our own team together.
Right.
Right now, I just think at this time when things are very stressful because of COVID, it's important to lower stress, stay healthy. And so as I was saying about the hybrid event, it's up to you to go outside and enjoy the sunset and breathe, go for a swim and stay healthy. And I just want to thank everybody for participating in this wonderful presentation for Dennis. Thank you again, and have a wonderful evening. Thank you.
Okay.